Hi, I'm Dr. Anthony Tang, and I'm a breast oncoplastic surgeon. So what that means is that I basically look after all sorts of breast conditions. From something simple such as an infection, especially during or just after pregnancy, to other symptoms such as breast lumps or breast pain or sometimes discharge coming out from the breast. Even before she gives birth, what happens is that there are many changes that occurs in the breast. Now, a lot of more milk is being produced in what's known as the lobules, and these lobules lead towards many ducts, which then leads towards the nipple. Now, sometimes these ducts can get blocked, usually by oily secretions, and therefore the milk that is produced in the lobules, it's stuck. It can't really come out through the nipple. If these blockages are not relieved and continues to fester, then the milk which is stuck inside can start to get infected, and that's the start of mastitis. One of the earliest symptoms of mastitis is that certain areas of the breast starts to feel a little bit hard, and if you press on it, it might be a little bit painful as well. Now, as mastitis gets worse, then the skin over the particular area will start to become red, and the patient may start to get a fever as well. Now, if it progresses even further to a condition known as an abscess, then it's almost like a very big pimple, if you like. You'll feel one area of the breast being a bit soft, what's known as fluctuant, meaning it feels as though there's some liquid behind it. Once again, the lady at this stage would usually have a little bit of fever, and that area will be quite exquisitely tender. First of all, if the lady comes early to get help, then the treatment is a lot easier. For example, if it's just a little bit red over the skin, but there's no big pus collection that's formed as yet, then the treatment is quite simple, which is basically antibiotics. Obviously, the cause of this mastitis is the blockage of the duct, and you would want to relieve that blockage. And there are a lot of simple steps that can be done as well to relieve that particular blockage. Number one, it's quite important to continue breastfeeding at that stage. Okay, and the breastfeeding not in just one position, but in multiple positions, as suckling in multiple positions tends to release different ducts. Number two, just prior to breastfeeding, for about 5 minutes, it'll be quite wise to apply a warm compress over the breast. Now, this warm compress acts to dissolve that little bit of oily secretion that is in the duct, and hopefully by these simple measures, that secretion will be dissolved and the flow will be restored. Hence, the mastitis will then recover. See, if the lady came a little bit later and the abscess has already formed, then at some extreme cases, these collections of pus may need to be aspirated. In other words, we need to suck out the pus through a needle, or sometimes even a small surgery needs to be done in order to relieve the pus which is built up underneath. These kinds of treatment, of course, usually is in the realm of breast specialists. Now, it's very difficult for most people who are not medically trained to be able to distinguish between a simple infection and a potentially dangerous breast cancer. Hence, it is always very wise, especially for the first time you get some kind of infection such as mastitis, to get it diagnosed and properly treated by a specialist. So all ladies out there, do try to continue to breastfeed. If you have difficulties, whether it's pain, congestion, infection, then do see a suitable specialist who will help you through this particular episode so that you can continue that bond with your child.